And welcome into To Your Health. You know, as we're aging, a lot of things happen to us in our lives. Today we've got with us Dr. Aggarwal, and you've been with us before, and we're glad to have you back because, Doctor, what we want to find out today is that from a urological standpoint, as we're aging, what things happen to us that can affect us?
You know, the most common thing which happens is the leakage of urine, especially in women. And a lot of time it's thought, oh, it's the aging process. Mm-hmm. There is actually a truth to it a little bit, but it doesn't have to be the way you have. This is not the way you have to live. There are so many options we have, and we can treat those with minimal things like starting from medications to pelvic floor therapies to some in-office procedures.
So
like Botox.
Are medications
there
to
are
prevent frequent urination?
Absolutely, there are
Yes.
medications. Actually, there are some behavioral modifications alone, and some pelvic floor therapy, which for some patients that work, and you don't even need medications. Mm-hmm. So definitely seek out, care and help in these situations. And actually, I think I mentioned before, I am actually the only one who is certified to treat these conditions in whole Central Alabama.
I know you're
Yes.
you're the only one in our entire region who actually deals with the mesh. So if
Right.
any of our people
Mm-hmm.
have had that or are dissatisfied, here's the specialist right here. And we're so happy to have you too. Let us remind everybody that you're at the multi-specialty clinic where we have UAB docs and the Baptist Medical Center. So we have the first of its kind with this kind of specialties. And we don't have to have a referral to see you, is that right?
Yes, you can just call our office and make an appointment.
Okay, that's wonderful.
Yes,
And
absolutely.
then, Jack, I think we had talked about something else that's a topic because we like for everybody to be informed.
Yes.
And that is erectile dysfunction.
Absolutely.
And that is something that older people deal with.
Right, actually, it's funny you say older people, but it's very
Yeah.
common.
I was just going to ask, when did it can start early, can't it?
Yes, absolutely. There is a study to show men above 40 years of age, 50% of them will have some kind of erectile dysfunction.
Mm-hmm.
So it's not a disease of older people only. It starts as young as 40 years or even younger.
So it's really not a disease. It's just the fact that you're not as active.
It is part of our aging process as well,
Yes.
you can say, but there are so many options. Starting for we need to check some tests. First of all, testosterone also is is one of the reasons it can be low and cause erectile dysfunction. So we need to do workup, do some blood test, and if those things are normal, then we start with medications. We have injections, we have vacuum devices, and finally, if nothing works, we have prosthesis, a surgical procedure where you put in a prosthesis, you can use it at the time of you need it. So there are we have multiple options for that
So
as
it's
well.
possible that could be just as simple as testosterone?
Right, yes.
Okay.
So, a lot of men, as they age, they have, testosterone level drops. And you'll be surprised to know there's so many young people we see, they have low testosterone as well. And, testosterone has been hyped a lot in the press and by a lot of one flawed study that it can be bad. That's true, but only if you don't use it properly and if you just give it to people who don't need it just based on the level. So, you have to have an expert who knows how to deal with these issues and when to treat with testosterone and when not to treat with testosterone. But as I mentioned, testosterone is one of the reasons, low testosterone is one of the reasons men can have erectile dysfunction as well. And besides other symptoms of low testosterone, like, mood swings and lethargy, fatigue, and especially, if a man comes home and he just wants to sleep after dinner, that's one of the very, very common symptom of low testosterone. I'm not saying that everybody will have that low testosterone with those symptoms, but this is one of the most commonly used symptoms.
Very interesting.
Yeah.
Medication, obviously diet is important too, is it not?
Well, diet is important. If you lose some weight, as we grow fat,
Yes.
the fat makes some cells which breaks down our testosterone. So, and it converts into actually female hormones called estrogen. So
Yes.
So that's why those people will have low testosterone levels. So it's good. It's the best thing to have a low fat diet, lose some weight, start with the things which you don't need medications for, and then we have medications and other options.
Excellent.
That's right.
I love the way you try to treat without any medications and surgery.
Right.
You try to figure it out first.
Right. No, my approach is always conservative. I would first of all find out the problem and then treat with minimal invasive things to maximal invasive. I always give an option of no medication if somebody wants to do that, and then medication, then other things, and then surgery if needed and if somebody wants it.
Mm-hmm.
All right. I think that helps us a lot.
That's
helps
it.
us understand.
Absolutely, absolutely. Well, thank you very much.
Thank you.
You're getting all settled in here now, right?
Yes, I am.
Great.
Yeah.
We're going to have you back, and what you need to do is if there's something happening that we need to know about, you call us, and we're going to get you on.
Of course. Thank you so much.
Okay? And
Welcome
thank you
to
very
our
much.
area.
And
Thank
just
you.
remember this, it's a clinic that you do not need a referral. It's right here. It's located at Baptist South, right on the Southern Boulevard, and you just call ahead. And better be calling soon because they are booking up heavy duty here. And we'll be right back right after this.